If you're watching this video, chances are that you're one of the nearly half of American women who claim to be unhappy with their breasts. Whether you were born with small breasts or they've changed in size and shape over time, there are a host of solutions available to get you the look you long for. While a great bra or fashion tape can do wonders for appearances, those sincerely unhappy with their bust size or shape may find surgery to be the best option. Before moving forward with any breast enhancement, there are some basic guidelines you should keep in mind in order to decide which procedure is right for you. And as with any major decision, you should weigh the pros and cons, make sure you're well educated and informed, and do everything possible to minimize the risks. The first and most important step is choosing the right doctor. While any doctor can call themselves board certified, a true specialist is one that is actually board certified in plastic surgery. Put your mind at ease by checking your doctor's training, credentials, license, and board certification. Next, you need to determine if you're a good candidate for the procedure. A good candidate is one who has realistic expectations and one who is willing to follow the doctor's pre- and post-surgery plan to a T. This should be determined during your consultation, and you should be prepared to have an open and honest conversation with your doctor. The more you're able to clearly express your expectations, the easier it will be for your doctor to exceed them. Although one size definitely does not fit all, ideal breasts should be symmetrical and proportionate to your body. And while you probably have some specific ideas for how you'd like your breasts to look, you'll want to educate yourself on all of your options. If you're unhappy with the form and feel of your breasts, talk with your doctor about breast augmentation options. Also known as mammoplasty, this surgical procedure involves the insertion of breast implants. There are several options to consider when getting breast implants that include the material that the implant is made of, such as saline or silicone, the shape of the implant, and the desired size, which varies depending on your desired look. Be sure to discuss with your doctor which implant option is best for your body. If it's sagging breasts that bother you, ask your doctor about a breast lift. During this procedure, excess skin is removed and underlying breast tissue is tightened to support a higher positioning of the breasts. In some patients, breast implants may also be used in conjunction with a breast lift. If you've always been bothered by breasts that are too large, a breast reduction is the only permanent way to reduce their size. Since weight gain can, in some cases, affect your result, it's important that you're at a stable weight before having the procedure. Your doctor should put your mind at ease during your consultation, so don't be afraid to ask questions. Establishing the look that's best for you is the fun part, but it's important to understand potential complications, alternative options, recovery time, and modifications you may need to make to your daily schedule should you decide to move forward with the procedure. Don't forget to ask these questions during your consultation. And don't be afraid to ask about additional fees or payment plans. Gathering all of the necessary information you need will help you make an informed decision. The more you share with your doctor, the more likely you are to be pleased with the final results. So make sure you clearly communicate what you want and, more importantly, what you don't want. Once all of your options are discussed and your questions are answered, it's time to book your appointment.
My name is Haley. I'm from Greenville, North Carolina. I chose Zenas Plastic Surgery because they had really good advertisement and they had a special going on when I decided to get it done. And the price was definitely a big deciding factor in it, but they had really good advertisement that brought me here. My experience at Zenas was great. He was very comfortable. The staff was great. They were all really nice and they made me feel comfortable throughout the whole experience. My experience with the staff was really great. They all made me feel comfortable. Walking in the door, I was greeted And throughout the whole thing, I never felt like anybody was judging me. I felt like they were all very, very kind. During my procedure, the staff was really comforting. Right before, one of them held my hand, so it made me feel a lot better about going under, because that was the first time I've ever been put to sleep. So it was pretty scary, but they were all really nice and they made me feel comfortable. They made me feel like it was gonna be okay. After my surgery, when I got home, I felt like I could definitely call them if I needed anything. They let me know that if I needed anything, that they were at the other end of the phone. So it definitely was comforting.
My name is Sue from Baltimore. I have had a breast reduction and tummy tuck. I came to Dr. Zanis because there was no plastic surgeon in our town, and I knew that he had good credentials and that he would be on the cutting edge of technology with his skills from where he went to school and did his residency. Dr. Zanis is just a caring physician. He absolutely is a sculptor of your body. He takes every step to make sure that you're going to be well and follow up after the surgery. You don't just have surgery and then see you later. You have a year of follow-up, and it's great because you know he really cares. My experience with the staff after surgery was exceptional. The ladies couldn't have been nicer. They too were very caring and concerned to make sure that everything was just perfect. I would highly recommend friends, family to come to Dr. Zanis and the Zanis Center for Plastic Surgery. In fact, I have recommended several people and they have come, and they've been pleased and happy with their results as well. In the future, should I need another little lip tuck in another area, you bet I'm going to be here.
Is the loose skin on your face or a sagging chin making you look tired or feel older even when you're well rested? If you're interested in how to dramatically rejuvenate your appearance to look younger and refreshed, a facelift can take years off your look, but one type of facelift definitely does not fit all. Each face ages differently, whether it involves sagging skin, wrinkles, or both. Here is what you need to know. Before moving forward with a facelift or any cosmetic enhancement, there are some basic guidelines you should keep in mind in order to decide if the procedure is right for you. And as with any major decision, you should weigh the pros and cons, make sure you're well educated and informed, and do everything possible to minimize the risks. The first and most important step is choosing the right doctor. While any doctor can call themselves board certified, a true specialist is one that is actually board certified in plastic surgery. Put your mind at ease by checking your doctor's training, credentials, license, and board certification. Next, you need to determine if you're a good candidate for the procedure. A good candidate is one who has realistic expectations and one who is willing to follow the doctor's pre- and post-surgery plan to a T. This should be determined during your consultation, and you should be prepared to have an open and honest conversation with your doctor. The more you're able to clearly express your expectations, the easier it will be for your doctor to exceed them. There are several different types of procedures available: traditional, mini, and mid-facelift. The type of facelift you and your doctor choose will depend on the severity of skin laxity and other signs of aging you're looking to address. This video will educate you on the facelift procedure options your doctor might discuss with you. A traditional facelift is ideal for addressing multiple signs of aging, including excess facial skin, deep facial creases, and heavy lines and wrinkles. It's often performed using an SMAS, or submascular aponeurotic system, in which incisions are made near the ears, enabling deeper layers of muscle and tissue to be pulled tighter, while excess skin is removed and wrinkles are smoothed out. If you're looking to address early signs of aging in the mid-face, including the cheeks and nasolabial folds, a mini facelift may be the option for you. This limited incision option, usually placed at the temples and hairline area, allows your surgeon to access underlying tissue and muscle. A mid-facelift is a term used to describe a limited incision facelift that targets the middle portion of the face. This procedure is ideal for those candidates with deep folds around the mouth and mild sagging in the cheeks. It can be performed using endoscopic technology, cameras that allow surgeons to view and reach distant anatomies through very small incision sites. Imagining a younger-looking you is the fun part, but it's important to understand potential complications, alternative options, recovery time, and modifications you may need to make to your daily schedule should you decide to move forward with the procedure. Don't forget to ask these questions during your consultation, and don't forget to ask about additional fees or payment plans. Gathering all of the necessary information you need will help you make an informed decision. You should come prepared with images you like, but keep in mind these photos should be used as inspiration only. Just because you like something doesn't mean it's right for you. The more you share with your doctor, the more likely you are to be pleased with the final results. So make sure you clearly communicate what you want and, more importantly, what you don't want. Your doctor should put your mind at ease during your consultation, so don't be afraid to ask questions. Once all of your options are discussed and your questions are answered, it's time to book your appointment.
My name is Laura. I'm from Wilmington, North Carolina. I decided to come to Zanis Plastic Surgery because I've seen Dr. Zanis in the operating room. I have a ton of respect for him and his surgical practice, and that's why I chose him. The thing about having surgery here is it's kind of a spa-like experience. We have very soothing music, the lights are low, you come into the operating suite and you get under a nice warm blanket. So we try to make it very peaceful and calm, and you're very, very asleep for the entire process. I mean, you don't know anything, you're getting pain medication, so you wake up comfortable. You know, if you need anything when you wake up, you get more pain medication. So it's a very pleasant, we try to make it a very pleasant experience in the operating room. The staff here is great. I mean, they are so nice. They make you feel so comfortable. They are just wonderful. They're great at what they do. I think the most of them, I just think really highly of them. I have a lot of respect for everyone that works here, and if I can say that and seeing what they do, and they can take care of me any day. I chose Dr. Zanis. I work here. I contract with Dr. Zanis to provide anesthesia services. And so I actually see what he does. I see the results. And my before and afters are proof enough for me. So I just love Dr. Zanis. I think he does a great job.
Let's face it, aging is inevitable. For years, facelifts and similar procedures were the only way to restore a youthful appearance, until injectables and fillers revolutionized the beauty world with a fast, easy, non-invasive approach to anti-aging. Whether you're concerned with volume loss in your cheeks, lines between your brows, under-eye hollows, or the wrinkles and folds around your mouth, injectables and fillers have quickly become one of the most requested cosmetic treatments today. There are a number of options that address a wide range of concerns, so it's important to be well educated and informed before deciding which injectables or fillers are right for you. The first and most important step is choosing the right doctor. While any doctor can call themselves board certified, a true specialist is one that is actually board certified in plastic surgery. Put your mind at ease by checking your doctor's training, credentials, license, and board certification. Next, you need to determine if you're a good candidate for the treatment. A good candidate is one who has realistic expectations and one who is willing to follow the doctor's pre- and post-treatment plan to a T. This should be determined during your consultation, and you should be prepared to have an open and honest conversation with your doctor. The more you're able to clearly express your expectations, the easier it will be for your doctor to exceed them. With so many injectable and filler options available today, it's important to discuss your specific concerns with your doctor, who has the expertise to determine the right approach for you. Typically, a combination of injectables and fillers yields the most dramatic yet natural-looking results. This video will educate you on some of the options your doctor might discuss with you. If your biggest concern is smoothing out lines that result from repeat facial movements such as smiling, frowning, and squinting, neurotoxins may be the best option. These work by blocking the nerve receptors on muscles to smooth out and soften lines and wrinkles, restoring a youthful appearance. Hyaluronic acid fillers are an excellent way to fill in and plump up wrinkles and folds on your face and add volume to features that look flat or sunken in, especially on the cheeks, lips, tear troughs, temples, and jawline. If you suffer from lost volume and are looking to plump up the affected areas and smooth out your skin, calcium-based and polyl-lactic acid fillers may be the right option for you. Prompting your body to produce new collagen, these fillers smooth skin while also increasing volume in those troubled areas that develop over time. Even though injectables and fillers are non-invasive anti-aging procedures, you should still gather all of the necessary information in order to help you make an informed decision. The more you share with your doctor, the more likely you are to be pleased with the final results. So make sure you clearly communicate what you want, and more importantly, what you don't want. Your doctor should put your mind at ease during your consultation, so don't be afraid to ask questions. Anticipating your results is the fun part, but it's important to understand potential complications, alternative options, and recovery time should you decide to move forward with the treatment. Don't forget to ask these questions during your consultation, and don't be afraid to ask about additional fees or payment plans. Once all of your options are discussed and your questions are answered, it's time to book your appointment.
My name is Dr. John Zanis. I'm a board-certified plastic surgeon and the founder of the Zanis Center for Plastic Surgery here in New Bern, North Carolina. Our mission statement consists of two main things. The first one is to deliver an end result that is superior in quality. And you can achieve that by going to any plastic surgeon who has great training, who is board certified, who has the experience, but there's more to it than that, and that extra element is what we try to add. It's not just the surgical skill and the technique, although that's critical, it's the personal relationship. It is the experience that the patient has when they come in to see you. And we want, number two, to provide the most amazing experience you can imagine. The staff here is really phenomenal, and that's what I think makes this place so special. We work together as a team and as a family, but each person was hand-selected to fulfill the mission of the practice. They're qualified, they're experienced, they have the technical skills, but they're good, real people with good hearts who truly care about each person that comes here. The facility is state-of-the-art. Every exam room is equipped with iPads and computers and with high-tech digital cameras, etc., for documenting what's going on here. Our two operating rooms here are fully accredited by the Quad ASF accrediting body, which means that they have been thoroughly reviewed and deemed safe for surgery and outpatient surgery. And that's key, that's important, that anywhere you go is an accredited facility. We started the Renova Spa and Wellness Center as an extension of the practice here. And what it offers is the non-surgical components that complete the picture of rejuvenation and cosmetic care. Medical estheticians, medical massage therapists, people who can really provide the non-surgical aspects of rejuvenation and a holistic approach to the patient's needs. I'm very passionate about what I do, and the same passion I have for my kids and my family, I bring that passion here to my patients and the people we help. I'm excited to restore their confidence and help them feel better about themselves. And I try to do it with integrity and compassion and help you to create a new reality. And I think that we do that here, and that's why patients keep coming back.
My name is Jim, and I am from New Bern, North Carolina. I chose Dr. Zanis because I had had an accident and broke my thumb and lost my thumbnail. And I chose Dr. Zanis because I felt the most comfortable with his skills to be able to help me correct the problem with my thumb and rehabilitate. During the procedure, Dr. Zanis was very delicate. He wanted to make sure I was in no pain and would not start until I was actually in no pain. And once he started, it was basically over. Well, the staff is very warm here. They're an excellent staff. They always remember your name. They always have a big smile on their face when they see you. They're very interested in your results. They're interested in your family. They're interested in you as a person. They're just great people. During my recovery, the staff here actually went above and beyond by visiting me at my home and offering to change out sutures for me because I wasn't comfortable with it myself. So they actually visited my home and took care of me. I would definitely recommend Dr. Zanis for any reconstructive needs that you have. He's an excellent doctor, and his staff are kind and very professional.